Today's episode is about one expectation that applies across healthcare. Whether you are in a hospital, a clinic, a health plan, or a vendor, anyone who touches patient data. The expectation is simple to say and easy to delay. Keep your security risk analysis current and act on what it finds. Let's set the stage with a quick real-world reminder. OCR, the Office for Civil Rights at HHS, recently announced a settlement after a ransomware attack at a HIPAA business associate. Investigators found that the firm had not completed a security risk analysis. The result was a $175,000 payment and a 2-year corrective action plan. OCR also noted that this was part of a growing set of enforcement actions tied to ransomware and missing risk analyses. The headline isn't ransomware, it's that the analysis wasn't done, and when the stress test hit, the gaps showed. That's the part that applies to everyone. When we say security risk analysis, or SRA, we are talking about a thorough look at where electronic protected health information, or EPHI, lives, how it flows, who can access it, and what could go wrong. Then, just as important, we're talking about a plan to reduce those risks with owners and timelines. Think of the SRA as both a map and a to-do list. The map shows you where the information actually is, the list tells you what to fix, in what order, and who is responsible for each task. If you're a covered entity, a provider, or a health plan, you already know that HIPAA expects this. If you're a business associate, an IT company, a billing service, or any of the others, the expectation is the same. The data doesn't get less sensitive when it leaves the clinic or hospital. The chain is only as strong as its weakest link. So there's also a policy signal pushing this in the same direction. In the new IPPS LTCH final rule that we covered a couple weeks back, CMS asked hospitals not only to attest that they conducted an SRA, but also that they are actively managing risks on an ongoing basis. It's subtle, but it matters. It says the SRA is not just a one-time event. It's the beginning of steady, visible action. So what does good look like in practice? Start with scope. A strong SRA is enterprise-wide. It doesn't stop just at the EHR. It includes file shares, imaging, patient messaging, telehealth, laptops, mobile devices, and any third-party system where EPHI lands. It also covers people and process, how access is granted, how offboarding works, where backups are stored, and how incidents are reported. The next is clarity. The SRA should be written in a way that your team actually understands. Label the risks in plain language. Tie each one to a specific safeguard. Assign an owner, set a realistic due date, and if the document is too vague or too technical to drive action, change that. Otherwise, it won't help when it counts. Then comes follow through. This is the part that turns the analysis into protection. A simple rhythm works well. Meet monthly, review the open items, mark progress, unblock any stuck tasks, and record what changed. If you could show a 6-month story of risks that were identified, mitigations completed, and evidence saved, you'll be in a very different position than an organization that says, oh, we're planning to get to that. A quick word on the common pitfalls. Doing an SRA light, maybe a short checklist or a generic template that doesn't match your environment. If the output can't answer where is our EPHI, how is it protected, and what are our top 5 risks right now, then it's not enough. Treating your vendors as an afterthought. If a partner stores, transmits, or processes EPHI, they belong in your analysis. Confirm that you have a business associate agreement in place, understand how their access works, and document how you verify their safeguards. You don't just assume that they're fine. Skipping the basics because you're chasing new tools. Most incidents still trace back to old problems, whether that's weak or shared passwords, missing multi-factor authentication, stale access for people who have left the organization, unpatched systems, backups that were never even tested, or audit logs that no one reviews. Those basics are the fastest way to lower your risk. And finally, waiting for the right time. Environments change constantly with new staff, new apps, updates, acquisitions. If you try to time the SRA for when everything is stable, you will never start. So put it on the calendar and keep it current as things change. Let's talk about the benefits beyond checking the box. A current SRA shortens your response time when something goes wrong. If you already know where your sensitive systems are, where your logs live, and how to isolate affected devices, you move faster. It also makes budgeting easier. When leadership sees a prioritized list with clear risk reduction tied to each item, it is much simpler to approve the work. And it helps with outside expectations. Insurers, auditors, and major partners are increasingly asking for proof that you have done your analysis and acted on it. Here are a few quick clarifiers just to keep you out of trouble. Number one, multi-factor authentication everywhere you can get it, especially for remote access, VPN, email, and any admin or cloud consoles. It's one of the best defenses that you can turn on quickly. Number two, access reviews that actually happen. Pick your most sensitive systems and do a monthly look. Who has access? Who changed roles? Who left? And what should be removed? Number three, backups verified with restores. Completion reports are not proof. Pick a file set or a VM and do a test restore on a schedule, and then save that evidence. Number four, audit logs turned into action. Make sure that the right systems are logging, then schedule a lightweight review. You don't need a room full of screens, you just need a routine. And number five, training that matches the job. Front desk, clinical staff, IT, each of these groups need different examples and cues. Keep it short, relevant, at least annually, with quick refreshers when things change. For vendors and partners, here's what to keep in view. You are part of the compliance story, even if you never see a patient. That means doing your own risk analysis, documenting how you secure customer data, limiting and auditing privileged access, and being clear about your incident and notification process. If you use subcontractors, extend the same expectations to them and keep your agreements updated. Your customers may ask for proof. Having it ready builds trust and shortens sales cycles. For providers and health plans, here's a helpful habit. Track the SRA and the risk management plan the same way that you track other operational work. If it only lives in a binder or in its own shared drive that no one opens, then it's going to slide. If it's part of your regular leadership rhythm with owners and due dates, you will see steady progress. You might be thinking, we did an SRA last year, do we really need to do another one? The answer is that it needs to be current. If you've changed any systems, if you've added locations, migrated to new tools, or made staffing changes, update the analysis and the plan. Don't start from scratch, build on last year's work. That's faster and more honest to how environments evolve. Let me close with a quick sanity check you can run this week. 5 questions, and you should be able to answer each of these in under a minute. When was your last security risk analysis finalized, and where is the current version saved? What are your top 5 open risks today? Who owns them, and when is the next update due? Where are your most important audit logs, and who reviews them on a schedule? When did you last test a backup restore, and where did you save the evidence of that? And which vendors have access to a PHI, and do you have a current business associate agreement in place with each? If those answers are crisp, you are in a good place. If not, then you found your starting list. The expectation that applies to everyone, providers and business associates alike, is simple. Keep your security risk analysis current. Let it guide real improvements. That's the foundation of strong compliance and a safer environment for patient data. If your organization needs support getting an SRA on the calendar, working through the analysis, or organizing documentation, Medcurity can help. Even if you're in a situation that we don't handle directly, we will help point you to a trustworthy path forward. So reach out when you are ready to get started.